I think Tim is hope to the community. He got in the trenches with his patients. They became connected to him. Because of him, doors opened. They received care. And so I think Tim represents hope. I'm Holly Freeman, and I'm Tim Freeman's wife. Some would call me a widow, but I still wear my ring. I feel like he and I are still connected. He started off as a social worker in Price Hill, then decided to pivot over to going to medical school. During his residency, here he meets Jean and Sharon. They were a couple who were married and also who had adult developmental disabilities. That was fascinating to him. He really connected with them. It started with Sharon and Jean, and then snowballed. He fell in love with the people who he served, and what became apparent was, wow, there is a medical desert out there for adults with developmental disabilities. So he was ready to serve. He felt passionate about, there's no way I'm going to leave this population. He opened up his heart and his practice. If you needed a doctor to see somebody in your family who had disabilities, Tim Freeman was your person.
He didn't limit himself to an identity that would, keep him from doing certain things. He loved life for life's sake.
In the way that this Freeman Center is designed, having so many different services in one place, I know that he is so pleased because this is what the patients deserve. These are people who are part of our community. They deserve to have bigger rooms. They deserve to have Hoyer lifts. They deserve to have a sensory room. It just makes it more efficient, better for the patient, better outcomes. So many more people are going to be served in this space. The possibility of educating more residents, so that this can have a ripple effect. The last thing that I want to see is that the Freeman Center becomes a unicorn. I want the Freeman Center to become a model for other people to see and then to replicate.
I think philanthropy is the catalyst for changing the standard of care, because people will see that there is a different way, and that different way should be the way. People should be treated like this, and this should be the norm. And without philanthropy, it can't happen.
Philanthropy is essential. Philanthropy allows us to dream bigger and to provide better care, more critical care. I see philanthropy too it's for the dreamers. Tim had so much passion for the world. This is Tim's statement about his photographic work. Everyday people, 23 years, 4,000 to 6,000 patient visits per year, births, growing, transitions, tragedies, triumphs, struggles, and deaths. Faces of humanity condensed into brief encounters, fleeting glimpses, gestures, momentary expressions over the years. It has changed, shaped me in ways I could have never imagined. I have given all I can to it, to them. I have been privileged to receive their reciprocation in the honor of access to the intimacy of ones and the breadth of many. I'm a family doctor. These are the faces of my patients photographed at the time of their office visits. They are beautiful to me throughout the range of their expressions, whether reserved, troubled, happy, or playful. They represent the face of humanity I have come to know and love.